If you're a man in your 6th decade of life or beyond, and you find yourself waking up in the middle of the night to visit the bathroom more than once, struggling to fully empty your bladder, or standing at the toilet feeling like you're waiting forever for the stream to begin, please pay close attention. You may have been told that such issues are simply a normal part of aging. But in my years as a prostate specialist, I have witnessed time and again that these discomforts are not inevitable consequences of growing older. Rather, they are signals from your body telling you that your prostate is reacting to certain everyday behaviors. These patterns, often so ingrained that we hardly notice them, can prompt the prostate gland to enlarge, become heavier, and place pressure on the urinary system. The encouraging news is that once you recognize what you're doing, you can make adjustments to give your body the chance to rebalance, ease inflammation, and restore your comfort. Imagine treating your prostate the way you would a sensitive instrument. Every action you take that strains or irritates it is akin to subjecting that instrument to unnecessary stress. Over time, just as a delicate piece of machinery would falter if misused, your prostate responds to persistent strain by changing structurally. It thickens, it swells, and it tightens around the urethra, the vital canal through which urine exits the bladder. In essence, what may start as a minor inconvenience can evolve into a cycle of increased urgency, nighttime trips, and diminished control. Consider the simple act of holding your urine. We've all done it: put off using a restroom while driving, delay relief to finish a task, or ignore that gentle urge until it becomes a shout. Occasionally postponing urination may seem harmless, but when it becomes a habitual practice, it places undue pressure not just on the bladder, but on the prostate too. The prostate sits just beneath the bladder like a supportive base, cradling the urethra in its ring-like structure. When the bladder fills and expands upward and downward during prolonged retention, it exerts direct force onto surrounding tissues. This repetitive pressure irritates the prostate, causing microscopic injury and inflammation that accumulate over months and years. The once flexible gland becomes a hardened barrier, narrowing the pathway for urine and forcing the bladder muscle to contract more forcefully to push fluid through. This sequence, known as bladder outlet obstruction, not only causes trouble initiating and sustaining a steady stream, but also weakens the bladder muscle over time. What begins as a brief moment of discomfort can eventually manifest as a chronic struggle to empty and, in the worst cases, lead to urinary retention emergencies. To counteract this, consider responding to your body's signals as promptly as you would any other urgent call for help. When the initial sensation of needing to go rises, make the trip. This practice alleviates pressure on the prostate and retrains the bladder to operate within its comfortable capacity. Over weeks, you may notice smoother starts, stronger flows, and fewer disruptive awakenings. Beyond the mechanics of holding urine lies another everyday habit often overlooked: the habit of ignoring constipation. At first glance, bowel regularity might seem unrelated to prostate well-being, yet the two systems share intimate anatomical proximity. When stool remains in the colon, especially if it's hard or compacted, it presses against the back wall of the prostate. Think of it as a firm weight pushing against a delicate sponge. This unrelenting pressure restricts blood flow, irritates nerves, and triggers a low-grade inflammatory response that doesn't stay confined to the colon. It spreads to adjacent tissues, including the prostate gland. Over time, chronic inflammation becomes one of the driving forces behind benign prostatic hyperplasia, the medical term for prostate enlargement. Moreover, constipation disrupts the gut microbiome, the complex community of bacteria that line your digestive tract. When stool lingers, harmful bacteria can proliferate, while beneficial strains diminish. This imbalance, known as dysbiosis, has ripple effects throughout the body, fueling systemic inflammation that reaches the prostate. The typical Western diet, heavy in refined carbohydrates, red meat, cheese, and low in fiber and hydration, only exacerbates this problem, making stool firmer and more difficult to pass. As the cycle repeats, pain and pressure intensify and urinary patterns worsen. The solution lies in nurturing regular, comfortable bowel movements. Integrating more fiber-rich foods into your meals: oats, whole grains, legumes, cooked vegetables, fruits such as pears and prunes, along with natural sources of omega-3 south, like flaxseed and chia, softens stool and promotes transit. Coupled with adequate water intake and gentle physical activity, these changes encourage regular evacuation, relieve pressure on the prostate, and ease systemic inflammation. You might start to feel lighter, more energized, and notice a reduction in urinary urgency as the gland finally gets its chance to relax. There is another habit I frequently discuss with patients, one that often catches them by surprise because its effects are far from obvious. It is the tendency to remain seated for prolonged periods. Many of us spend hours at a time anchored to chairs behind desks, in front of televisions, or scrolling on phones, rarely pausing to stand, stretch, or walk. While resting your body may seem restful, the reality is that idleness, particularly in the pelvic region, stifles circulation. Your prostate, like every other organ, relies on a steady flow of oxygen-rich blood to carry nutrients and remove metabolic waste. When you sit immobile for too long, venous return slows, lymphatic drainage diminishes, and toxins can build up in the pelvic tissues. Imagine a river slowed to a trickle. Sediment settles, water becomes stagnant, and life in the river struggles. Similarly, reduced blood flow around the prostate encourages local stagnation and low-grade inflammation. Over time, the gland can become engorged and irritated, contributing further to the challenges of bladder outlet obstruction. The remedy is simple yet powerful. Introduce movement snacks throughout your day. Every half hour, pause to stand, walk around, or gently stretch your lower back. Even a minute or two of leg swings while leaning on a counter can stir circulation and refresh the tissues. Integrate short walks, gentle pelvic tilts, or seated marches to break up long periods of sitting. These minor adjustments keep blood flowing, support toxin clearance, and maintain tissue flexibility in the prostate and surrounding structures. Implementing these three strategies, responding promptly to the need to urinate, maintaining regular bowel habits, and interspersing your day with gentle movement, can transform your urinary comfort. I have witnessed countless men in their 60s, 70s, and even 80s reclaim good flow, reduce nighttime trips, and wake up feeling rested rather than anxious and uncomfortable. They achieve this without medications or invasive procedures, simply by tuning into their body's signals and making incremental changes. It's important to remember that these adjustments are most effective when adopted as part of a broader approach to wellness. Staying hydrated with water rather than excessive caffeine or alcohol, limiting foods that promote inflammation, such as processed meats and refined sugars, and managing stress through mindfulness or breathing exercises all contribute to a healthier prostate. A balanced diet abundant in antioxidants, healthy fats, lean proteins, and phytonutrients supports cellular health and can further. If you ever notice blood in your urine, significant pain in the pelvic region, or a sudden inability to urinate, seek medical attention immediately. While benign prostate enlargement is common, these signs can indicate other conditions that require specialist evaluation. For many men, the prospect of prostate issues brings fear of losing autonomy, quality of life, or the discomfort of medical treatments. But by integrating these small, manageable practices into your daily routine, you shift the narrative from helplessness to empowerment. You remind your body that it's not at the mercy of aging, but capable of remarkable resilience. Each toilet visit answered promptly, each day of regular bowel movements, and every movement snack you take becomes an act of care toward your prostate. Your body is not broken, it is communicating its needs. And it's never too late to listen. Whether you're just noticing slight dribbling, feeling a bit rushed to the bathroom, or waking twice nightly, understand that these are whispers asking for attention before they become a shout. By changing 3 deceptively simple habits, letting yourself go when you first feel the need, prioritizing fiber and fluid to avoid constipation, and staying active with small bursts of movement, you can restore balance, reduce inflammation, and reclaim comfort.